By what age should an infant have doubled its birth weight? A. 9 months. B. 6 months. C. 12 months. D. 3 months. The answer is B. 6 months. An infant should have doubled its birth weight by the age of 6 months, and tripled its birth weight by the age of 12 months. Children who fail to reach these markers may be underweight due to a variety of factors such as underfeeding, metabolic disorder, or failure to thrive. Which of the following is not part of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, Diagnostic Criteria for Autism Spectrum Disorder, ASD? A. Hyper or hyporeactivity to sensory input or unusual interests in sensory aspects of the environment. B. Highly restricted, fixated interests that are abnormal in intensity or focus. C. Hyperactivity impulsivity have been present for at least 6 months to an extent that is disruptive and inappropriate for the person's developmental level. D. Stereotyped or repetitive motor movements, use of objects, or speech. The answer is C. Hyperactivity impulsivity have been present for at least 6 months to an extent that is disruptive and inappropriate for the person's developmental level. All of the behaviors listed are part of the diagnostic criteria for autism spectrum disorder except for disruptive hyperactivity impulsivity present for a period of greater than 6 months, which is part of the DSM-5's diagnostic criteria for attention deficit hyperactivity disorder, ADHD, not for autism spectrum disorder, ASD. A mother brings her 7-year-old daughter into the emergency room after she fell while riding her bike. She was not wearing a helmet and she hit her head on the asphalt. Which of the following is not a sign of late-stage increased intracranial pressure, ICP, in a pediatric patient? A. Dilated scalp veins. B. Bradycardia. C. Diminished level of consciousness. D. Fixed, dilated pupils. The answer is A. Dilated scalp veins. Diminished level of consciousness, bradycardia, and fixed and dilated pupils are all signs of later stage intracranial pressure, ICP. Dilated scalp veins may be present with ICP, but will be seen in the early stages of the condition. A nurse is instructing a parent on proper care for their 7-year-old son who has recently been diagnosed with a seizure disorder. In regards to care during a seizure, the nurse should advise the parent to do all of the following except dash. A. Note the length of the seizure. B. Place a padded tongue blade in the child's mouth. C. Stay with the child for the duration of the episode. D. Move furniture away. The answer is B. Place a padded tongue blade in the child's mouth. A parent of a child with a seizure disorder should be instructed to stay with the child through the duration of the seizure, to move any nearby furniture out of the way of the child to prevent trauma, and to note and record the length of the seizure. No object should ever be put into the mouth of a child who is having a seizure. Which of the following would increase suspicion of strabismus in a pediatric patient? A. The child does not respond to loud or sudden noises. B. Difficulty holding eye contact or responding to social cues. C. The child complains of frequent nausea. D. The child consistently squints or tilts head to see. The answer is D. The child consistently squints or tilts head to see. Strabismus is a misalignment of the eyes that results in one eye becoming dominant over the other. It does not affect hearing or ability to connect to others socially. This condition should not result in nausea.